Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be doing a slideshow presentation and presenting information on Lamotrigine, or Lamictal. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And just quickly, if at any time during this video you find the information valuable, please consider leaving a like on this video as it really helps me with the YouTube algorithm. So first off, what will we cover in this presentation? First, we're going to talk about how this medication works. We're going to talk about indications or reasons it would be prescribed. We're going to talk about contraindications or reasons the medication would not be able to be used by a patient. We're going to discuss dosing with some examples. And we're also going to discuss side effects with percentages. So how does lamotrigine or Lamictal work? So it inhibits the release of glutamate and inhibits voltage-sensitive sodium channels, which stabilizes neuronal membranes. Now, when would this medication be prescribed or used? So we see this medication used in bipolar I disorder. We see it used to treat partial seizures. We also see it used in tonic-clonic seizures. And lastly, we see it used in Lennox-Gastaut syndrome, which is a complex, rare, and severe childhood onset of epilepsy. Now, for contraindications or reasons patients would not be able to use this medication, the only real contraindication in this case would be a hypersensitivity or allergy to lamotrigine or any other component of the product. And I also have this other point here, which is not a contraindication, but it should be used cautiously in patients who have severe renal or kidney impairment. Now we're going to talk about dosing in bipolar I as well as in partial seizure. So in bipolar I disorder, if this medication is being used without valproic acid, we would typically start off with 25 milligrams a day for 2 weeks, then increase to 50 milligrams a day for 2 weeks, then 100 milligrams a day for 1 week, and then 200 milligrams per day. If this medication is being added to valproic acid, we might see a regimen such as 25 milligrams per day every other day for 2 weeks, then 25 milligrams a day for 2 weeks, 50 milligrams a day for 1 week, and then 100 milligrams per day. In partial seizure, when it's being used as an adjunct therapy or add-on therapy, we would typically see 25 milligrams a day every other day for 2 weeks, then 25 milligrams a day for 2 weeks, then may increase the dose by 25 or 50 milligrams a day every 1 to 2 weeks, with a maintenance dose coming in somewhere between 100 to 400 milligrams per day in 1 or 2 divided doses. Now, what about side effects with lamotrigine or Lamictal? So we see that 7 to 14% of patients may develop a rash. Abdominal pain may come in between 5 and 10%. 5 and 11% of patients may experience diarrhea, and indigestion may happen 2 to 7% of the time. Nausea may happen between 7 and 25%, and vomiting may happen 5 to 20% of the time. Xerostomia, or dry mouth, comes in at a rate of 2 to 6%, and a backache may happen in 8% of patients. Asthenia, or abnormal weakness, may happen 2 to 8% of the time, and 3 to 7% of patients may experience coordination problems. Dizziness may happen 7 to 54% of the time, and 29% of patients may experience a headache. Insomnia may happen 5 to 10% of the time, and 9 to 17% of patients may experience somnolence. A tremor comes in between 4 and 10% of the time, and 11 to 25% may experience blurred vision. Dysmenorrhea comes in between 5 and 7%, and 10 to 14% may experience a pain in the throat. And fever comes in at 6%. Now, some more serious side effects. One would be a rash, and this would be a different type of rash than the rash that happens 7 to 14% of the time. This serious rash would happen less often. And finally, liver failure. That's all we're going to talk about today in this brief presentation about lamotrigine or Lamictal. As always, I'm very thankful you took the time to go by and watch one of my videos. If you found the information valuable and you'd like to help grow the channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. That's it for today. Take care.